Introduction. Blood shortages are common in several countries throughout the world, including Thailand. Blood centers have been established for collecting donated blood, screening of blood, preparing blood and blood products, and transferring safe blood to patients in a timely manner. In Thailand, a national blood center and regional centers were established for these responsibilities, to perform all activities of a supply chain system involved in moving safe blood from donors to patients and also disseminate information about blood transfusion to local people. The amount of blood collected is uncertainly only slowly, because of a lack of accurate knowledge about blood donation by non-donors. Moreover, the blood available for transfusion may decrease due to increasing strictness of blood screening tests used to reduce the risk of infection.
Overall of Red Cross. The king who gave birth to the Thai Red Cross. The blood service unit in the science section. In 1952, officially offered blood services to the public. In 1953, built the Ringsitana Zorn, Ringsit Memorial, building to house the office of the blood service unit, and blood donations took place only at the office. In 1955, to collect donations of blood outside the office by cars. In 1956, to bestow commemorative pins on people who had made 1, over 7, over 20, over 30, over 40, and over 50 donations of blood. In 1963, the Minister of Public Health assigned the Public Health Permanent Secretary to chair the first meeting of representatives from blood service authorities and agencies. In 1977, construct a 4-story building, which was completed in 1979, and where plasma components are separated and dry plasma is prepared.
For concept and policy. The concept of regionalization for blood service systems had been discussed in several countries, to reduce shortages, outdates and operating costs. While the quality of blood is sustained, local coordination and cooperation with the other regions are key strategies to perform the following policies. 1. Determining volunteer donor recruitment in the region. 2. Citing facilities to deliver blood to all hospitals in the region. 3. Providing total blood service within its area to schedule, in keeping with the requirements of the region. 4. Providing expert medical consultation, compatibility problems and other blood-related problems. 5. Providing the quantity of blood and its components required in the region, and 6. Meeting appropriate inspection and accreditation standards in order to improve inventory management.
Why blood shortage? Blood shortage crisis. Blood Red Cross out of stock crisis shortage nationwide. This is not the first time. So the question is, why is Thailand so short of blood? Because there is no blood factory. Blood must come from donations by faith from fellow human beings only. Blood is short life cycle. Because lack of suppliers or blood donor. No public relation between organization and society. We unknown demand and supply of blood and how to control product like expiration date of blood. It has high cost of medical equipment and services.
We choose fishbone diagram to show the problem about blood shortage. The first problems is uncertainty of demand and supply. We can't control from donor, high patient and has emergency case in every day. Second problem is operation management about blood supply, form the number of safety stock, produce life cycle, production control, replenishment and information management. The last one is transportation with mobile and number of trucks to support each hospital.
In this slide, we show the blood supply chain process. It starts from getting blood from donor and then transfer to blood center to test, process, store for delivery. After ordering blood from hospitals or healthcare, blood center will test patient blood with donor blood. If it's okay, they will prepare in package delivery, and then those hospitals will picking up to their hospitals and cure their patients onward. Based on the problem, blood supply chain is the integration issue of all level of model, such as strategy level, tactical level, and operation level. Therefore, the supply chain operation reference, SCOR, model and Porter model is proposed to improve operation in blood center for our project.
For SCOR model, the supply chain operations reference model. SCOR is a management tool used to address, improve, and communicate supply chain management decisions within a company and with suppliers and customers of a company. The model integrates business concepts of process re-engineering, benchmarking, and measurement into its framework. This framework focuses on 5 areas of the supply chain: plan, source, make, deliver, and return.
Our adaptation of the Porter's model to the blood center, we rename each of the categories to be closer to the hospital terminology in 2 processes, support process and primary process. In the support processes, support primary activities by providing human, technical and material resources. Dividing as following. Human resource management by recruiting and training people for admission, emergency technicians, nurses and physicians, administrative and personnel, and lastly recruiting for donors. Technology development and decision support system, blood bank information system, blood safety program, automated prescription software, and the last is in planning and scheduling software. Material resource management and procurement, catering, and waste management. Next, the primary processes are activities devoted to care patients. Among these processes, primary activities are divided into 6 subcategories. 1. Admission logistics, processes associated with patients' admission and management of their documents. 2. Care, processes associated with care patients and management. 3. Inbound logistics, processes associated with blood's purchase and reception. 4. Operation, processes associated with blood preparation. 5. Outbound logistics, processes associated with the distribution throughout the hospital. 6. Marketing and service, processes associated with blood testing, blood care, blood and material maintenance cost.
In blood flow on SCORE model, it contains 1. A standard description, 5 keys of management processes, plan, source and S1 source donor, S2 source normal or specialty, S3 source packing and tools, make M1 blood transfusion normality or specialty, M2 blood test, M3 blood packing, delivery D1 delivery normality or specialty, and return delivery or source RD1 or RS1 return defect blood, RD2 or RS2 return borrow blood, RD3 or RS3 return excess blood. 2. A framework of relationships among the standard processes from source until return. 3. Standard metrics to measure process performance, management practices that produce best-in-class performance, and a standard alignment to software features and functionality.
The diagram shows how we try to adapt SCORE model with blood supply chain flow from donors until patients, the end user. First, its plan, its process, balance blood demand and blood supply, capacity to develop a course of actions which best meets admission. Start from source, there are standard steps for donor from register until giving blood and rest. It also displays the national blood centers and several channels. Then make, it performs the process of blood from first collecting to blood testing and blood separating components. Next, it show the delivery from blood centers to hospitals and then patient at varied demand, its forecast around 2,000 units, day. Lastly but not least, return, it is for the return of defect blood, borrow or excess.
We decided to use RFID to manage the inventory of blood bank, so we have to know what is radio frequency identification. RFID is the use of radio waves to read and capture information stored on a tag attached to an object. It is passive and active for manage inventory. Why we use RFID in blood bank? Because it can remove necessity for human interaction, accurate stock 98% for inventory management, and it is automate inventory and delivery process. We can checking stock 100%.
We use RFID in 5 major units of blood operation. The first, RFID tags and the blood product management process is offering a great possibility for process and help to realize major improvements in storage and distribution of blood products. There is the potential to facilitate the product identification during collection, processing and distribution, and to monitor storage and distribution of finished goods as long as these remain in the same container. Moreover, the data transported on the blood bag allows for efficient sharing of information among the different stakeholders, depending on security levels. For manufacturer, blood bags integrated RFID tags allow the manufacturer to use the ID for identification within processes of blood bags to assembly the other that information related with logistic process and holding such as lot number, expiration date, and, in the future, possibly the single unit tag could be stored on the tag and shared with the customers.
For donation unit, if blood bag systems with integrated RFID labels are not available, Tags could be added at the collection site the data during the donation process. The release of the collection bag set, the bag tear and expiration date could be checked by the collection device software. Moreover, relevant donation data such as user, time and date, collection period, weight, and in the future, possibly, unique lab tube numbers, etc. could be written to the tag. Processing RFID allows automatic identification of the bags within the read range. Major improvements are possible, including the ability for bulk reading and no need for line of sight for scanning, which make it easy for employees to perform concurrent manual activities. Storage and distribution. Quality and /or security checks, for example visual controls, specimens for content measuring and so on are often registered on paper sheets. These could be monitored more easily and rules enforcement could be checked at several points within the distribution chain. Moreover, RFID can reduce paperwork from one channel to next channel. Product turnover could be more easily managed to reduce outdating, and units required to meet specific clinical requirements could be more rapidly located and /or reallocated during the distribution process. Bulk packaging could be checked for completeness and the transmission of shipment information could be done rapidly using the RFID label.
Conclusion. Blood supply chains play a key role in the healthcare systems. Any improvement in the management of these chains will have a direct impact on the supply of blood as a life-saving product. We use the Porter's model to identify the best strategy to follow according to the market context. To go further in our analysis, we tend to apply the SCORE model to describe processes, to make comparisons between practices to get benchmarks and to define performance measures. We use RFID to improve the operation by manage inventory from manufacturing of blood bags, donor to blood center to be accuracy and efficiency. Thank you very much.